So, regardless of which type of mesothelioma we're talking about, we can look to this book to confirm that any remaining doubt about the association between asbestos exposure and mesothelioma was completely gone after Wagner's 1960 study. Again, we said there's only about 3,000 cases a year in the US, and they studied 33 cases, this time in South Africa, and 32 of those cases had exposure to asbestos. That's a crazy high number, and that's why they were able to pinpoint mesothelioma has a lot to do with asbestos exposure. This was confirmed by the mid 60s by a doctor named Selikoff, Dr. Irving Selikoff, who became very famous for the work that he did with mesothelioma among union workers, especially in plants, including, if you remember the advertisement that I showed in video number 2 from UNARCO, Union Asbestos and Rubber. Dr. Selikoff worked with a lot of workers from UNARCO's plants. But by this point, 1960 is what we're talking about, and this is when medical science noticed asbestos could cause mesothelioma. The Asbestos Risk Assessment book by Dodson and Hammer has this to say, and this tracks with my experience with the individuals who I've represented who've had mesothelioma. The majority of patients diagnosed with pleural mesothelioma present in the exact same manner. The most common presentation is shortness of breath or dyspnea on exertion, which is almost always caused by a pleural effusion on the side where the tumor is identified. That has been exactly how my experiences have tracked. We've had clients who they went to their doctor because they're having shortness of breath and pain on the side, a pleural effusion, which is an excess amount of fluid, is discovered, and then they find a tumor, and that's mesothelioma. It's a very terrible disease, and it's always fatal. The book continues that the greater the exposure to asbestos and the greater the inhalation of asbestos in the lungs, the greater the risk of an individual developing mesothelioma. Again, we track back to that concept of dose response. The more you breathe, the more likely you are to have a response. And the book continues that the published information indicates that it takes significantly less asbestos exposure to cause mesothelioma than it does to cause lung cancer or asbestosis. They don't know why. Science does not understand why mesothelioma doesn't require as much asbestos exposure as lung cancer. We don't know. This is still an ongoing, changing area of medical science.